The last class of medications we're going to talk about as part of this makeup lecture is decongestants. When you have nasal congestion, there are various kinds of decongestants that can work either very temporarily or longer term to kind of keep those nasal passages more open. So what decongestants do is they work directly on that sympathetic nervous system. They affect the alpha receptors in the blood vessels, and they cause vasoconstriction. If they are taken topically in a nasal spray or nose drops, they cause vasoconstriction locally at the area where the nose is stuffy. If they're taken systemically, they are going to vasoconstrict the body or the blood vessels all over. And of course, we know what happens when there's systemic vasoconstriction. You've got heart rate going up, you've got blood pressure going up, and not everybody can tolerate that well. But a decongestant can help short term to relieve nasal congestion from somebody who has allergies, for somebody who has a cold, or some other kind of upper respiratory virus. So you can spray it directly on your nasal mucosa or take as pills. And of course, we know that the main decongestant is pseudoephedrine or Sudafed. It's a sympathomimetic. On page 113, you've got a table of different decongestants. You've got the nasal sprays, and then you've got the drugs that work systemically. But Sudafed's kind of our prototype drug. Now, the topicals are only intended to be used for a few days because the nasal passages get used very quickly to having that medication that reacts and causes that vasoconstriction. And so in return, there's going to be some temporary vasoconstriction, maybe last for an hour or so, if that, but then things are going to swell up again. And then you're going to vasoconstrict again, and then they'll swell up again. And sometimes you can end up having what's called a rebound effect, to where the capillaries in the nose and nasopharynx will constrict, but then they'll dilate even bigger than usual with all the accompanying side effects. So it's recommended that you only use it for 3 to 5 days. And usually that would get you through a common cold or a bout of allergies. But you'll see a lot of people who use these constantly. They keep using them. Some people they can't get by without, a bottle of nose drops or, their little Afrin nasal spray in their shirt pocket. So it does work. It relieves nasal congestion, but some people can get addicted and they can cause worse problems. And so it's best to tell people to stop using the decongestant. And if they still feel like they're stuffy, you can get commercial saline nasal sprays that salt is going to temporarily constrict those blood vessals, but just do it topically. It's not going to work on the central nervous system to give you like a sympathetic reaction. Because of those adrenergic effects, systemic decongestants shouldn't be used at all, or should be used with extreme care by people with hypertension. Generally, they recommend that they not be used at all because you're going to have systemic vasoconstriction. Your blood vessels are going to constrict all over, and that's going to make the heart rate go up and the blood pressure go up. So if people have cardiac problems or hypertension, it's not recommended. There are some over-the-counter decongestants that are sort of geared toward people with cardiac problems. I think Coricidin D is one of them. And you'll see that it's got like a big red heart on the front that indicates that it's safer for cardiac patients. But if I had a loved one who had hypertension or cardiac issues, I would have them talk to their healthcare provider before they pick up anything over the counter. Apparently in 2007, the FDA took a lot of over-the-counter cough and cold meds off that were geared to pediatric patients. It was determined that these meds are just not safe for anybody under 2, pretty much. And even like from 2 to age 7, they've got really strong warnings. So I know when my kids were little, anytime they had a cold, I could just pick up anything I needed, and it would take care of their symptoms, but now that is no longer considered safe as of 2007. All right, this is where I left off. This is where I had started for the people who previously heard this lecture. So that's the end of the chapter 7 on respiratory and allergic meds. So make sure you read the textbook, listen to the lectures, read the ATI book in preparation for the test over chapter 7 and 8 that will come the second week that we're back at school.